Just a little rant for the day because I love all of you and I want everybody to be pain-free, but you have to start being open to this idea. Hey everybody, so this is, I don't even know how many times I've tried to film this, but I'm just gonna cut to the chase here. If you've been suffering in pain and you are doing certain things, whether that's on your nutritional side, that's your supplements, your medications, your exercise, all this type of stuff, and you are not getting the results that you want, meaning you're still in pain or you still have a chronic condition, one of the things that you might have to, you likely have to be open to is accepting ideas from somebody else and actually sticking with them and doing that thing. So we have patients, every now and then here at the clinic who they come in, they're in chronic pain, they are here to try something different, and then you make recommendations and then they either don't do those things or they think that they know better and they go and they do something else, or they take part of what you say and they do part of it, but they don't do everything. And it is, I am a big proponent of actually working with patients, not just saying, here's what you need to do, but coming up on a game plan together. But when you work with a provider and you come up with a game plan together, you need to actually stick to that. You need to, it's almost like submitting yourself to the ideas of somebody else who is there to help guide you through that. And yes, some of those things may be difficult. Yes, that may include fasting. Yes, it may include, stopping eating ice cream. Or yes, it may include some other crazy ideas around nutrition that you never thought you'd have to do in a million years or never want to do in a million years. But at the end of the day, you have to be willing to do things now that may not be enjoyable, may be difficult, but if you continue down the path of doing the things your way and your way is not working, but then you go to work with a provider, but you still want to make it your way, you are unlikely to actually change the trajectory of your illness. You have to be willing to do things that you've never done before if you want to get a result that you've never had before. If you are in chronic pain and you want to get out of that chronic pain, and your way, your method, whether that's working with doctors and then tweaking it, if that has never worked and you're still in chronic pain, it might be time for you to stop doing that and to actually submit yourself to the ideas of somebody else. Do things that are uncomfortable, do things that you don't want to do in order to attempt to get a result that you've never had before, which is actually getting you out of chronic pain. Just a little rant for the day because I love all of you and I want everybody to be pain-free, but you have to start being open to this idea that maybe, just maybe, you have to do things that you're uncomfortable with in order to get the results that you want. Love you all. See you later.